This episode is dedicated to a conversation with Avishai Ben Tovim, the CEO of MDI, a company established in 2019. MDI developed a risk analysis system for polypharmacy patients that aims to handle these complex patients and create accurate clinical recommendations for treatment optimization and risk mitigation. Despite increased efforts in the field of adverse drug reaction prevention in the last decade, there appears to be an increase in drug-induced hospitalization and mortality rates. The medication management platform developed by MDI scales up the process of drug adverse event prevention and helps patients, physicians, and payors to avoid the clinical and financial consequences associated with drug-related adverse events. Overall, the company mission is to enable value-based care through focus on clinical quality and cost reduction. In this episode, we discuss the solution they provide, the validation they generated, and their future goals. Please walk me through your process from the moment you engage with the customer until your recommendation is accepted or declined.
So the first thing that we do for clients, and sometimes even no strings attached, is analyzing their population. And that enables us to really show the client upfront how much money they're actually losing every year by not working with us. And it's quite amazing when they're looking at their own data and seeing that actually, despite the fact they're running these NTM programs or other programs of care management, there's so many opportunities that we see, both in terms of RX cost savings and prevention of medical events. So first step is analyzing the total population, seeing what cohort we want to target. Once we decide on the cohort we want to go after, this is where we move from the high level understanding of the population to the individual level. And our system enables the clinical team to generate recommendation that would have taken them otherwise more than an hour to analyze. Now they have everything in front of them, so they know what problems need to be addressed. They know what suggested recommendation they should consider taking. And this process actually enables them to really do a case in a few clicks of a button in a very scalable way. And then we also help with sending their recommendations to the right place at the right time. So we have some tools that enables us to integrate into EMRs or to the relevant workflow, or to send these recommendations through any form or mean of communication the client wants us to send it to. And then we continuously getting data on the population and tracking both the outcomes of these recommendations, but also monitoring the population for new high-risk members.
So you think that at some point it would be used when the physician prescribes a drug to a patient?
Absolutely. Our North Star at the end is to really solve these problems, and the best way to solve it is to prevent it from even happening. So we're thinking of a future that we could be in real time at the point of prescription throughout the continuum of care. But currently, the way we're making impact is actually working as a corrective action, analyzing the total population and making the right recommendations after the patient already started taking the wrong medication.